Tonight we have Paul Ingraham with us, who's really kindly streaming all the way from Canada. Say hi and give us some of his expertise and knowledge. Hopefully there'll be lots of you joining us later, and feel free to ask questions and join in and comment as we go. It's great to see people communicating with us as we go. It always makes it flow nicely. So first things first, I'm going to pass over to Paul, who I hope will tell us a little bit about his career, how he got into pain, and a bit about his website too, if that's okay with you, Paul.
That is okay with me. I can tell you all of those things. I like that line, streaming all the way from Canada. Like, yeah. It's harder. So far.
Yeah, it's much harder.
It's much easier to stream to Seattle, Washington.
Yeah.
So my name is Paul Ingraham. I run the website painscience.com. That's my baby. It's been my domain for a long time now. I've been working on this project for about 20 years. And it's been in its current form with the name painscience.com since 2015. Before that, it was saveyourself.ca. It's a very busy website, about 1 million visitors every month, and an immense amount of content about chronic pain, mostly focusing on musculoskeletal injuries and pain chronicity. I am a former massage therapist, and that's how I got interested in the topic. Basically, I started writing self-help articles for my clients, and then that kind of took over and became a bigger deal than being a massage therapist. Started to attract a large audience, started to get very serious about doing it right, about treating it like a job in science journalism. I had been a writer before that. My entire life, I had been a writer. Massage therapy was supposed to be a day job to basically, you know, a nice way of making a living that would facilitate a transition into a longer term writing career. And that's exactly what happened. Yeah. I ended up writing for a living about chronic pain and injury rehab. So that's the basic backstory. And there were some adventures getting out of massage therapy. There was some excitement and controversy, and I believe that's one of the things you wanted to talk about today.
Yeah.
So that's the quick intro.
Yeah, cool. And did you, when you thought about being a writer, were you thinking you were going to do like science journalism? Was that the thing you wanted to write about?
No, I was a flake. In my 20s and most of my 30s, I believed all kinds of weird things. I was in, anything strange or occult. I was interested in it. I thought I was psychic when I was a kid. So I have this full-on flaky background, and I didn't really discover how cool science was until well into adulthood, around the time that I was starting this website. So around 2000, somewhere in there, I read Carl Sagan's absolutely amazing book, The Demon Haunted World. And it deeply challenged me and pissed me off and upset me. And I had to reread it 3 times. But by the time I was all done, I was a lot more interested in science and a lot less interested in believing things that I just wanted to believe, regardless of whether or not they were actually true.
Yeah.
And so I did what a lot of people do when they first discover science and skepticism. I was really overzealous at first, and I was an aggressive, enthusiastic debunker. And that characterized the first several years of my writing. Was the inspiration. I was really excited to tell the truth and to poke holes in pseudoscience and quackery and snake oil. And then I calmed down in the last decade. It's just been much more diligent, steady science reporting has been. That's what my job has turned into. Less debunking, more just reporting on the science and explaining it.
I think it's cool that you understand the people that you're trying to target. You understand why somebody might want to believe in ghosts or whatever it may be, the quackery that we're trying to debunk, because we're all just looking for answers, aren't we? And sometimes it's not necessarily the right ones that we find, but so it's great. It's cool. I like it. I like the way you got to it. Obviously, as a vet, and I think it leads on to what we're talking about, we're obsessed with science, particularly on CAM. We're obsessed with pain management. So we're speaking to the right person here, I think. You kind of talked about not believing things and believing things, which kind of leads me on to the topic of what we call caregiver placebo.
Diving right into the deep end.
Yeah, why not? Let's just get into it. Sure. So, I mean, do you mind talking a bit about that?
Yeah, sure. Placebo is I call it the deep end because this is a really tricky topic, but also fun and interesting. Lots of, I believe there's a lot of really prevalent misunderstandings about placebo, particularly when it comes to pain management. So we could start with caregiver placebo, which is basically just the appearance of an effect generated by someone believing that there's an effect about an animal or a person, either one, kind of a placebo by proxy, rather than letting the patient themselves report how they feel, and perhaps they can't if they're a dog or a cat or horse. You just you give it to them. Oh, look how well you're doing. The caregiver, the pet owner, or even a professional healthcare provider can believe that there's a treatment effect and basically declare it. And that's the placebo effect, or rather I should say, and this is a very important point, that is a placebo effect. We very often talk about the placebo effect as though there's only one or only one mechanism. And the most common and basic misunderstanding about placebo is that there are lots of placebo effects, lots of ways that you can end up with a placebo. It involves the appearance or illusion of an effect where there actually isn't any. It doesn't necessarily even refer to someone having changed sensation, for instance, or changed perception. Placebo effect can be an artifact of research creating the appearance of an effect where there is none. And that doesn't involve anything about someone believing something and getting a clinical benefit from it. That is literally just paperwork almost. It's the illusion created by the complexity of the research. So there's an enormous range of things that can cause a placebo. And one of them, and it's particularly prominent probably in your field, is that pet owners may believe that their pet is better and declare it to be so when there is in fact no objective evidence of that, which is ideally the only way that we judge whether or not there is actually a therapeutic effect. But as the pain guy, I will jump in there right at the end of all that. This is like one detailed conversation about this topic might get to this point and stop short. Very important pain follow-up. Pain is entirely subjective. It is extremely difficult to objectively, well, it's actually impossible to objectively evaluate pain because pain is by definition a subjective experience, which is a huge complication. Particularly, I would think, in your field.
Yeah, definitely. And I think, you'll probably feel differently about this because you do a lot in the human field as well. But I would argue from a personal point of view that if somebody gave me a pill and told me it would make me feel better and I did feel better, then I'd be cool with that. I'd think, okay, fine, even if it is placebo, if it works, I don't care. But we can't do that for pets. We can't say to a pet, okay, I'm going to give you this magic pill and that's going to make you feel a billion times better. If we're taking it and we are like putting our own emotion on it and saying, actually, he's loads better when the dog is actually not better, that is so detrimental to their health. It's so detrimental to suffering. And we do see it a lot. We do see that in our arthritic pets, especially because there's so much stuff out there. There's so many different remedies that people recommend. And I think you're right, it is hard. And then when you add in the objective monitoring that we have to then try and interpret a dog's behavior to try and make it objective, it adds a whole other element of complexity to that.
Which is, that's just pure black magic. You can't really ever, there are clues in behavior with humans as well as animals, but that's all you're getting. You're getting clues, and it can be so misleading, so easily misleading.
Yeah.
I don't care as long as it works thing is highly relevant. It's an issue with human placebo. It's also an issue with animal placebo, and this is again a particularly a pain specific issue with placebo. People tend to believe that because pain is an entirely subjective experience, that it should therefore be, whatever you can achieve, whatever pain reduction you can achieve with placebo is just medicine, right? It's if the subjective experience of pain is reduced, that's all there is to reduce. What else is there? Well, the answer is there actually is something else to reduce. And that's what people tend to miss about placebo for pain. Yeah. There's a reason that chronic pain is a massive social problem. Huge medical costs associated with chronic pain. It is an immense issue, and it hasn't been cured by sugar pills. Why is that? Why, if placebo is, or if pain is entirely subjective and placebo works, then why isn't everyone cured of their pain? And the simple technical answer, that's not a contradiction. The simple technical answer is that pain consists of both sensation and perception. Now, let me break that down for you. Sensation is pure neurology. It's the nociceptors in the tissues, the nerve endings that detect tissue threat, sending signals to the brain, and the brain more or less taking that at face value. But after that, everything gets super messy. So sensation is the relatively direct generation of information about threat from the tissues that the brain usually trusts. Perception is the incredibly complicated additional layer of psychology on top of that, which modulates sensation quite aggressively in some cases, particularly in humans. Humans are really, really good at top-down modulation because, neurologically speaking, we got a lot up top. We've got huge frontal lobes that can generate an immense amount of contradictory information. We can quite literally take a trivial threat signal from the tissues, which isn't pain yet. It's just information about, hey, there might be a problem down here. And it can amplify that dramatically, and vice versa. We can take incredibly trivial sensory cues and fluff them up into a pain crisis. And we can take incredibly strong information about threat, where there's objectively verifiable severe tissue damage, and we can down modulate that to almost nothing. Lots of famous examples of both. So that is why placebo is not a miracle cure, basically because we can't think our way out of pain consistently and deeply. We can get erratic top-down modulation of perception, which can be very useful at times, but it tends to be temporary, and it really falls flat where the sensory element is particularly strong. So if you have a pet with serious arthritis, and their tissue is in particularly bad shape, their brains are getting lots and lots of information about the state of, the dangerous state of their tissue, and they're not particularly into modulation because they don't have that big frontal lobe, then that animal is probably going to experience a bunch of pain, regardless of what its mood is, and regardless of what people believe about it. So that relationship between sensation and perception is critical to understanding why placebo isn't a miracle cure, tends to be overhyped, and why that very common sentiment of, well, if it works, what do I care? Who cares if it's not real medicine as long as I feel less pain? Well, that's great. It's just probably incomplete, probably temporary, and really can't do anything about sensation at all. And its effects on perception are erratic and less than perfect.
So, obviously you deal with this a lot with your website and with people's feedback. And as a vet, it's really difficult when we have a client come into the consult room and they really believe the pet is better. And what would be the best way to communicate this to them? What's the best way to sort of...
Oh, that's why I got out of being a clinician. It's really hard. Seriously, I joke, but only half. Writing about this stuff is so much easier than communicating with real people in clinical situations about it. And I imagine, I don't know, but I'm betting that it's particularly tricky to deal with people's beliefs about their pets.
Yeah.
Guessing?
Yeah, I can't talk from a human perspective because I don't treat people, but I think Lynn has commented on this saying it's hard to say to someone that the potion they've been giving for 3 years or more is not doing anything, their dog's still in pain and they've chucked a load of money down the drain. And there's some elements of that where people have heard from somebody down the street that this thing works and they spend all this money, and then they come to us and we're like, oh, your dog's been in a lot of pain for a long time, we should have seen this before. And I do think it is hard, and I think there's it's difficult because people have very strong and passionate beliefs about the way they want to manage their pet, and if it doesn't fit with how you do, it can cause a little bit of abrasiveness, I guess, between them. And it is so important to have good owner-vet relationships, so important, because otherwise nothing gets achieved. But it's tricky. So yeah, I don't.
And make no mistake, it's pretty hard to tell a person that they've been taking snake oil. That's also really difficult.
Yeah.
So I think there's there's an interesting dynamic when when people are talking about their beloved pets. That changes the equation a bit, but it's hard across the board. And my standard advice on this for years has been never ever never attempt a head-on debunking. When someone right in front of you has an emotionally important belief, don't go right at them with your objections. It's not going to turn out well. The beauty of writing about this stuff is that people come to you when they're ready. By definition, they're only there because they clicked something, because they wanted to read it. They only read on because they are interested in hearing more. Not that there isn't controversy and difficulty, but for the most part, the one-to-many publishing method of communicating this stuff is much emotionally easier, because most of my readers they're trying to find something out. They're looking to understand the topic better. But in the clinic, you're talking to someone who may have absolutely no idea that they're about to be challenged, and direct challenges don't work well. So my practice when I was a massage therapist was to basically, I never told people that they were wrong about anything, or that they, that they believed something incorrect. I waited for them to ask my opinion. And and if they're particularly, if there's a high potential for defensiveness, then you use the some people believe this, some people believe that model, where you make it very clear that you're aware of both sides, and that puts them at ease quite a bit. And then they can ask questions. If they want to know more about the other side, they can pursue it.
Yeah, that's kind of where we try. Yeah, we try and provide, Hannah's just called it passive education, but that is kind of what we try to do on CAM. We have a forum called Holly's Army, and if something comes up, then we'll discuss what would be a really good live, for example, caregiver placebo, and we would get on somebody who knows so much about that topic to come and speak to us. And then when these topics are coming up, we can say, do you want to go and watch this live and learn from the best in the field about that particular subject? It is harder in a consult.
Best in the field.
Well, I think so. But yeah, it's harder in a consult room when you've got 15 minutes and you haven't got the access to just give them a link. But yeah, on CAM we try and do our best to provide really good evidence-based medicine, and we try and explore all the topics, that particularly if stuff comes up that we've never heard of or that we don't know about. That's when we think, right, okay, we need to learn about this and see what what actually is behind it, what science is there behind it. Which kind of leads me on to the question with you of, could you explain a little bit about evidence-based medicine?
Sure, yeah. And I'm going to bookmark placebo a little bit. There's a couple of things I'd love to return to.
Okay, yeah.
Just because I think they'd be of particular interest to the people listening right now. But we'll circle back to it. But I'd love to touch on a couple of other points about placebo that I think everyone will enjoy. So yeah, evidence-based medicine, relatively new. That's a lot of people don't appreciate, I think, just how new it is. I think officially we're at about 20, 25 years of it now, which is starting to sound like a fair bit. But in terms of, in context of history of science, it's a shockingly new idea.
Yeah.
And very poorly understood. It takes a long time to get any complex idea to disseminate through a professional community. Generations, some people would argue. To a great extent, every kind of professional in every field that, wherever there's complex information, we're still dealing with the fetters of legacy information, received wisdom from our elders, many of whom at this stage in all our careers, right? Anyone working today, there's a good chance that they were taught by someone who basically had no idea about evidence-based medicine. It was not part of their world. Evidence-based medicine has always been around in spirit. And, for most of 20th century medical science, lots of doctors and lots of medical scientists were interested in the principles of evidence-based medicine, but it wasn't formalized. It wasn't turned into a movement, into a well-defined, set of marching orders for how medicine should be done until surprisingly recently. And then, even when it was, all kinds of problems. First of all, just straight up lack of acceptance, just full-on rejection. One of the most amazing things I remember from my years of working with the folks at sciencebasedmedicine.org, I was the assistant editor at that website for about 6 years, and dealt regularly with their editors and learned just an amazing amount of stuff from them, and they were just incredible mentors. But one of the memories that really stands out, at some point, Dr. Harriet Hall published a post about lack of acceptance of EBM in medicine. EBM rejection among doctors. And wow, it was dazzling. Both the stuff that she wrote about and the comments. The number of should know better doctors who said amazingly ignorant things about evidence, about science. Wow, it was breathtaking. It was a real eye-opener, a very strong reminder that doctors do not have a monopoly on sloppy thinking. It's not limited to alternative medicine and snake oil. There are plenty of doctors out there who don't get it, and that's been true the whole time. And here we are in 2020, and it's still a major issue.
Yeah.
Okay, that's a bottom. You got a question anywhere you want to take this next?
Well, no, I was just sort of wanting to explain that because we throw around the words evidence-based medicine all the time on CAM, and I think sometimes it becomes like something that doesn't mean anything. So I just wanted to clarify that. So do you think those doctors who aren't, following the science reports and things that are coming out all the time, do you think they're just doing it through experience? So they just know what they know and that's it. They're not willing to accept change.
Yeah, it's mostly driven by I know best based on my experience. And Mark Crislip, also of Science-Based Medicine, has a famous, funny quote. He says, "The three most dangerous words in medicine are in my experience." And that is because experience is extremely misleading. And while it's valuable and it has an important and official role in evidence-based medicine, it has to be balanced against what we've learned from basic science and from clinical trials.
Yeah.
The relying solely on experience, and there's a funny BMJ article from, oh gosh, I think it's 20 years old, that lists all of the things that you might base medicine on that aren't evidence, such as authority and tradition and experience and I can't list them all. It's about 9. They're very funny. Look it up. I can't think how to quickly look it up. Anyway, I'll make sure you get a link.
Yeah, that would be cool.
So yeah, almost everything but evidence is what medicine has been based on for its entire history, and primarily experience and authority. I think those are probably the two big ones.
Yeah.
We see in surgery, which is certainly relevant to arthritis. And actually, let me ask you a question. Are there surgeries for arthritis in animals? Is that a thing that happens?
Yeah.
Like knee replacements in humans?
Yeah, we have hip replacements, knee various different sort of stifle surgeries and things. Yeah.
Right. Okay. So there's a huge movement in human surgery right now to properly test surgical interventions. Really, really interesting study about 20 years ago now. One of the leaders in the field of pain science did one of the first ever placebo-controlled trials of debridement for arthritis, knee debridement. And the placebo intervention, where just a probe was inserted into the knee, performed just as well as the actual debridement. That was an earthquake. The world of surgery was very strongly eminence-based medicine, authority-based medicine. You did what your mentors told you to do, and you offer the surgical options that you learned to offer from them. And the idea of comparing a surgical intervention to a placebo was verboten. Not just not done, but actively opposed. And very rapidly over the last 20 years, that's been challenged. There's a really good book on this topic, Surgery, the Ultimate Placebo is the name of the book. It started with that study that, oh wow, everybody got better, whether they got actual debridement or just a probe inserted into their knee. That's amazing. Many, many more placebo-controlled trials of surgery have been done since then, with roughly 75 to 80% of them showing non-superiority of the intervention.
Really?
Most surgeries for painful problems, particularly orthopedic surgeries, don't do more than a placebo, which is mind-blowing.
Yeah.
And probably very relevant to veterinary medicine. So that's incredible. And the implications echo, and we're still learning. There's plenty of very popular procedures that are still being tested that still have not yet been compared to a placebo. And I think at this point, almost everybody in the world of orthopedic surgery knows that the writing is on the wall, that this is happening, that literally every single surgery in the field is on the chopping block and potentially going to be shown to be no better than a placebo. But you go back, just rewind 10 years, and it was still a radical idea that many people hadn't even heard of. So that's one of the most potent examples of the effect of evidence-based medicine on medicine. That when you decide that it's actually important to check and compare procedures, compare interventions to a placebo, it's amazing what you can learn.
Yeah, and it makes me like a little bit terrified as a clinician when I'm referring patients for surgery. Am I making the right choice or not? It's a big thing to think about.
Probably the main clinical implication is just that the bar is high, that you don't do surgery unless things are pretty bad. It's just generally to be avoided as long and as much as possible. because of the basic reality. And I don't know, this is a whole interesting, we could go on a huge tangent here, but in humans, what's going on in the tissue correlates really poorly with the subjective experience of pain. People can be, their joints can be in terrible shape and the patient is fine, and vice versa.
Yeah.
And there are reasons for this. We have, can you
Yeah.
comment on how that compares to veterinary
Yeah,
medicine?
we some, you know, we might have a dog in for, I don't know, maybe a routine something, and we do an X-ray and it's got horrendous hips, but the dog looks really, really good.
Right.
And vice versa. Yeah, we see the same thing. And I think, as you say, the experience of the dog, it's hard because it's hard, they can't tell us themselves, but we assume that dog is not in a lot of pain because of the behaviors we're interpreting, or vice versa. So yeah, it's fascinating.
Yeah. I wonder if dogs are amazing top-down pain modulators. This is something that I've wondered about quite a bit. I grew up with a black lab.
Yeah.
And as everybody knows, black labs, I mean, all dogs, but black labs are just, I mean, they just have the best attitude imaginable about life.
Yeah.
And I've wondered, you know, first of all, I've wondered what the gene is for that and where can I get one? I mean, what makes an animal so happy? How does that work neurologically? But I've also wondered, as a pain guy, you know, if it was a gene that makes labs so damn happy, and you could give a human that gene, would they suddenly have amazing mind over pain benefit? You know, it is possible that happy dogs experience a ton of pain, but it just doesn't put a dent in their mood. That they essentially have a good attitude about being in pain. It's also possible, and I don't think we have any way of knowing, that their good attitude actually modulates the pain, and they don't have nearly as much. So
I mean, you could argue that when they're really happy, they're releasing endorphins, and that's kind of that's a natural way to help with pain relief, isn't it? So I don't know, maybe there's an element of that as well.
Maybe, except it doesn't seem to work very well in humans. Humans can be very happy and still in a lot of pain. And I'm a chronic pain patient, for instance, which, by the way, I was not when I began this job. It's something that I came into about 5 years ago. And yet I'm still pretty happy-go-lucky. I can be delighted with life and still hurt. And so it's, I've definitely been there and thought, yeah, this could be what it's like for dogs.
I always try and talk about it with my patients, in that when I'm doing pain clinics, I talk about pain, and then I talk about suffering, the emotional component of it, because I think they are actually two separate things. They do influence each other, obviously, but in a person, you can say that, what's your pain out of 1 to 10, and how much is it affecting you out of 1 to 10, and then you could try and scale it. But we don't have that luxury in pets, unfortunately. But it is. I think it is important to distinguish between those, isn't it?
In humans, we don't actually know why there's such a poor correlation between tissue damage and pain. We tend to assume in the pain world these days that it's because of our amazing modulating powers. But I'm not actually convinced that that's the case. I think we probably still just don't know. And it is possible that there are significant X factors, that biological ones, that basically not all joint damage, not all tissue damage, not all arthritis is the same. And just because the tissue's in a poor state doesn't necessarily mean, for instance, that it's inflamed. That it could be a relatively simple way of explaining it, that you can have tissues that look pretty bad, but they're not hot, quote unquote hot. So exactly why things don't line up, we're not totally sure. And my guess is that animals have to be, particularly dogs, have to be really in rough shape to act like it. they've got to be
Yeah.
suffering quite badly. And I would guess that they tend to be their behavior. A bigger factor in their behavior is probably their attentiveness to their people than their own pain, which is very hard for a lot of humans to relate to.
Yeah.
Imagine not acting like you're in pain because you just don't want anyone around you to know. You're more interested in pleasing them. A
Yeah.
lot of people couldn't possibly do that, but it comes very naturally to dogs.
Yeah. I think also, you know, I talk about this all the time, but we don't really 100% understand dog behavior yet. And I think we on Cam, we desperately try and teach people about very subtle changes, because it can be such a small change that could be an indicator of like didn't want it, they may be totally normal, wanting to do their walk, still everything else is fine, but when you think about it, they haven't initiated play with their toy with you for ages, or there's something really small that you wouldn't even notice has changed before it gets really bad, which is normally when they come to the vet at the point where they're limping or they don't want to get up anymore, or it's really, or they can't jump in the car, or something more obvious. But I think there are subtle signs where sometimes, like daydreaming, the dog can go quite daydreamy, and I think that can be a sign, because normally dogs are going to be asleep or they're listening to you. So the second you move, well, everyone knows this, when you get up, you're first to go, and if it stops doing that, I always think, So yeah, I do think maybe there is some kind of element of us not understanding their behavior,
and just being fooled by their eagerness to be responsive. This is a great segue back to what I wanted to bookmark about placebo. May I rewind to placebo?
Yeah.
How many do you think that the story of Hans the clever horse is very widely known among vets?
Well, it's not by me, so I'd love to hear it.
Okay, it's a famous story in the world of skepticism and knowledge of cognitive distortion and how we fool ourselves, which is a very deep world. It's most people are blissfully ignorant of the number of ways that we can fool ourselves and be fooled. Brains and perception really imperfect, incredibly imperfect. So the story of Hans, which I'm sure many listeners will know, but for those who don't, this was a very clever horse, but not in the way that people thought. Basically, Hans had a manager who profited handsomely from showing off his horse's ability to count. He would give Hans a number, and Hans would tap his hoof the number of times that his handler had specified. And of course, horses aren't supposed to be able to count, so this was very impressive to people. Well, I bet most vets can guess what was really going on, but it's still cool and impressive. Hans was paying attention to subtle cues. He was not counting to 7. He was waiting to see very subtle body language in his handler, so he would know from observation when he had reached the target number. And this has been demonstrated countless times in animals since then. And so the lesson for placebo is that who says animals aren't amazingly sensitive and responsive to subtle cues in their caregivers? The vet as well as the owner, I'm sure, both. Basically, dogs know probably, cats know probably when you want them to feel better or to act like they feel better. I have really no question at all that we shouldn't underestimate this ability in animals to be incredibly empathic and to respond to cues that we don't even know that we're giving out. I mean, quite literally, probably even things we have no capacity to detect. I wouldn't be surprised, for instance, that there are olfactory cues that dogs pick up on and change their behavior around us because of it. There's this really common thing with placebo and animals where people who are selling what I consider to be rank quackery, so we'll take the example, say, of homeopathy. I've heard this argument from homeopaths many, many times over the years, that they know that their nostrums work because they make animals better, and animals are immune to placebo. Their whole argument rests on the idea that the animal is immune to placebo. Animals are not immune to placebo. In fact, it's worse, because placebo is basically anything that creates the illusion of a treatment effect where there is none. There are now actually multiple layers. There are more ways for that illusion to happen, particularly because almost entirely the people who believe that the animal is better for this reason have a strong bias in favor of coming to that conclusion. They want to believe that the animal is better, and the animal can't argue. The animal can't say, actually, my knee really still hurts. They can't interject.
Yeah.
And so it's this almost freakishly good opportunity for the snake oil salesperson to claim an effect where there is none and not get contradicted.
Yeah.
Hannah, you have, or not Hannah, sorry, Esme, you have frozen. Am I still okay?
Oh,
are we still okay?
You're still fine. I think we're still okay. Hopefully people can know if they're having any issues. Just kind of leading on from that, we've had a really interesting comment. You can still hear me, can you?
I can still hear you, yes.
Cool.
And I see that comment,
so So Patricia said, this lockdown has made a huge difference to my brother's border collie who has arthritis in her feet. I visited today because he thought she was ill, and he also had back pain, sciatica, and needed medication for both of them. Jess the dog became agile and happy as soon as I was there bringing toys to play with. This made my brother feel happier, and he said his back was feeling better. So just shows the power of, the relationship between a dog and its owner. You see your dog feeling better, then he makes you emotionally and physically feel better. I think it's amazing. Wow. They are the best creatures.
That's cool.
Yeah.
And now suddenly I can't believe I don't have an article about the value of animal companionship in treating chronic pain. How have I not written about this?
Oh, they're the best though, aren't they? There's nothing better. It doesn't matter how bad your day is. You always feel a little bit happy because you've got the dog there, always, or a cat, or whoever. But yeah, they are good. And Carol's just said as well, they've survived living with us so well and so long because of their skills at reading us and pleasing us. Just they are, like you were saying,
absolutely
desperate to please us. Yeah.
Yeah, and biologically selected for it. I mean, it's this powerful survival advantage for quite a long time now. Basically, ever since animals got domesticated animals got their foothold in our lives, it would have just been relentlessly potent selection pressure. Any characteristic they have that gives them an edge in interpreting human desires and moods would have been tremendously advantageous. So no wonder it's
really cool
to a perfection.
Yeah, and they're saying that I know there's a lot of interest at the moment. You're talking about smells, and they think that because people always wonder how the dog knows the time, and they think that there's some kind of deterioration in. So, for example, if the dog knows when you're going to come home, they think it's because the smell of you in the house is slowly deteriorating to a point, and they know that you always come back when it gets to a certain level. That's one of the theories at the moment that I've heard, which is just like absolutely mind blowing. Yeah, it was really cool.
That's a really great example of a sensory cue that we're oblivious to. I heard a fantastic story about recently about how people who live in the very far north orient themselves geographically in the environment, and one of the locals took the journalist out into what looked to her like the middle of nowhere, spun her around blindfolded and said, "Now tell me which way is which." And of course she couldn't. And he said, "I can tell you, it's impossible for me to not know." And he pointed to how did this work again? So it basically prevailing wind patterns constantly nudge grains of sand and small pieces of gravel in a certain way, so that there's just a little bit, just a subtle lee behind every larger rock. It's like moss on the side of a tree. Same basic idea. So as long as you know the prevalent winds in the area, you always know which way you're pointing. And it's just, this is too much of a tangent for the point, but yet a great example of things we are oblivious to. If you know, it's easy. And if you can smell it, it's easy. So if you can smell how long your owner's been gone, piece of cake.
Yeah, that's so cool, isn't it? Those real amazing senses that animals have, and obviously people like that who know these amazing cool things that the rest of us don't know. Although I'm rubbish anyway, I can't even reverse a journey. If I drive somewhere, I can't get myself home, so I'm good at that. That wouldn't help me. Cool. So is there anything else you wanted to cover on placebo?
Oh, probably. It's a huge topic. Let me look. I took a couple notes before we started. Yeah, I mean, this is soapbox. Just want to have a little rant about this. There's a very annoying trend in alternative medicine. This was one of the earliest things to get me fired up back in the 2000s and get to work on debunking things. The trend is that the power of placebo is aggrandized as a justification for therapy that can't beat a placebo. And this topic will probably challenge some listeners. So let's just take it for the sake of argument, and it's definitely an argument, that acupuncture doesn't work. It's pure magical medicine. So take that as a premise.
You're talking to acupuncturists, so I'll warn you.
I'm sorry, I didn't quite hear that.
Oh, I said you're talking to a vet acupuncturist here, so yeah, I'm keeping my eye on you.
Oh boy. Okay, that makes this so much more interesting. Cool. The problem with arthritis evidence is people believe that there's a lot of evidence for acupuncture. Unfortunately, a very large amount of that evidence is either terrible quality, it just can't be trusted, it's just crappy quality, or it shows no benefit over placebo, but this is interpreted as a win. And we see many prominent examples of this. It's interpreted as a win because placebo is worshipped as being potent and powerful. So if a treatment works as well as placebo, it must be good because placebo is good. This wouldn't cut the mustard. This would not fly at all in the world of pharmaceuticals, for instance. If your doctor tried to give you a pill and said, it didn't beat a placebo in a trial, but don't worry, that's a good thing because placebo is really potent. So therefore, this drug is good. This trick has been used very extensively in the world of acupuncture. So I can be somewhat diplomatic with you and work around the question of whether or not acupuncture actually works. And you can probably accept or take my word that this has been a huge problem in interpreting the research.
I mean, honestly, from personal experience, I find the studies incredibly frustrating, even because, so in animals, there's not that many studies. We haven't got enough studies. We have some promising ones, but not many. But one of the biggest problems with acupuncture, well, there's two. One is that a lot of them are on Chinese medicine, and they work on the basis of you putting a needle into a certain point, and then the placebo is putting a needle into another point slightly further away, and then comparing them. So that's never going to work because in the acupuncture I follow, it doesn't. I do Western-based approach, so you can put a needle in most places and you'll have some kind of response. That's one problem. And the other problem is, how do you do a placebo where you don't actually put a needle into the body and make that person or pet believe they are having acupuncture? So I think there's a lot of issues with the actual methods of a lot of the studies out there, because I think the studies have all these, some of them say, oh yeah, it's brilliant, some say it's terrible, but then when you read the actual study, you think, well, that is not comparing acupuncture with not acupuncture. That's my big qualm. And like, I think before you carry on and you tell us what you need to say, but I think there is we need more studies. We do.
Mm-hmm. Yeah, and some experts disagree vehemently that we've already studied acupuncture more than enough, and lots of energy has been put into methodology and trying to come up with a credible sham. There's about 8 different ways of doing it. They all have pros and cons. But bottom line is, I'll agree with you that we probably don't know everything we'd like to know. But this is typical with designing trials for any intervention. It's often extremely difficult, and the basic mission of science and of clinical trials is to control variables, and variables, it turns out, are hard to control. There's a lot of them, and they're unruly. And so it's really difficult to control all the variables. And until you have truly controlled all the variables, you can't ever really know. So we teeter on the edge of an abyss of acupuncture debate here. Shall we back away from that for now?
We could get into it, and then all we talk about is acupuncture because it's my area, so it might be dangerous. Thing to dive,
and it's just a huge topic. The aggrandization of the power of placebo, regardless of the efficacy of acupuncture, is a huge problem. People need to stop thinking in terms of placebo being powerful. Another really common placebo myth that I can escape from the acupuncture topic to this is a really common thing that has come up with placebo in the last few years, and it's again highly relevant to animals. It's amazing how much of this topic is relevant to vets. I wonder, I wish I could see a show of hands how many people have heard the idea that you can get a placebo without deception. And there is no way to get that show of hands, so I'll just guess and say that lots of people have heard that. And it all comes from one bad study. That idea that you can generate a placebo without any kind of lie about what it does is just bogus, because that paper was based entirely on this tactic. This is a placebo. We're giving you a placebo, so we're not deceiving you. But placebos are really powerful and awesome. So go ahead.
Yeah.
And all they've done is swapped one lie for another. All they've done is trade one kind of deception for another. Telling people, powering up the placebo by talking like it's the best thing ever, is just another kind of deception, which is fine. It's not necessarily, we don't necessarily need placebo without deception. But that idea that it works even if people know that it's a placebo has gotten an immense amount of airtime and led a lot of people down, I think, the wrong way to think about placebo. They still created an expectation. And that's the heart of the deception of placebo. If the patient expects a result, they're more likely to experience or report a result. And it doesn't matter where that expectation came from, whether it's saying this is real medicine when in fact it's just a sugar pill, or whether it's saying this is just a placebo, but it's super awesome, trust me. Either way, you're generating an expectation, and expectations have effects, and particularly I would bet they have effects in pet owners. If the pet owner believes that something is going to be great for their dog, then it will be in their minds.
Does it? I guess it's just as powerful if you suggest negatively, then, is it? You can have a negative placebo effect.
Yeah, also called the nocebo. That's a real word if you haven't encountered it before. It's the expectation of a negative effect, and it's quite potent. And I wonder how that works with animals. I wonder where that's relevant. What human clinicians have to be careful with human patients, because we're such amazing top-down modulators, and we can both mute and amplify pain. We have to be super careful with human patients not to scare them. And the most common way that we do that is with telling them that they're in rough shape, that their joints are in bad shape. It's very common with arthritis, and very common with all kinds of other problems that have nothing to do with arthritis, but arthritis is what the scan shows. So that's what the doctor tells the patient. Your spine is a mess. It's bone on bone. Phrases like that scare people and plant a very compelling expectation of a bad outcome. And
this is making me laugh
careful with that with humans.
This is something I wind my husband up about, because he's really bad for if a doctor says something, even just as like a mild suggestion, that's it. He's diagnosed himself with that. And he had a bad back last year, and they told him it could be spondylitis, and he had x-rays, and it took a few weeks for the results to come back, and then they all came back fine, and he didn't have it. But in that time, his back was getting worse and worse and worse, and then when he got the good results, he was fine. And equally, he's just had a sleep study because he snores a lot, and they said the word sleep apnea. So then he decided he had sleep apnea because he's so tired all the time. And I can guarantee, because I have to sleep next to that snoring, he does not wake up all night. He snores through the whole night. He sleeps perfectly, and that results come back now, and he hasn't got sleep apnea. But I think it's something that you do. It's very easy with just a little bit of suggestion, isn't it, to take on board that information, particularly if you're frightened of the result. I guess you can sort of fixate on things, and I guess that's kind of similar in what you're saying.
Yeah, and my first impulse is to think that probably animals are largely immune to nocebo, but I'm guessing that I'm wrong about that, in the same way that that people shouldn't assume that animals are immune to placebo. If animals are subject to placebo and expectation effects, then probably it works in the negative direction as well. Although maybe the amazingly good attitude of dogs is good protection against that. Maybe it's hard to convince a dog to worry.
Yeah. I wonder if then, obviously we talk about caregiver placebo, but maybe people are too negative because of nocebo. So it's a little bit fascinating.
Yeah. Well, and you tell me, I believe I have heard that neurosis can be an issue with dogs, that pets in general, they can be neurotic. They can be, is that a thing?
Yeah. Definitely. It's just hard to put, because we end up sort of putting our human emotions on dogs, don't we? So it's hard to interpret. I'm believing more and more. I mean, we already knew they were clever, but there is so much interesting stuff coming out about particularly dog intelligence. And once we start to understand their behaviors and what they're actually saying to us, if we can interpret that, I mean, they're way more clever than us. They understand like our words, they understand us, but we don't necessarily understand them. And I find that just absolutely mind-blowing. They're so intelligent. So I wouldn't be surprised if there is some element of that. And particularly if, they go to the vets and they have some kind of expectation of what's going to happen there, if it then affects the way their disease is being perceived to them afterwards. I wouldn't be surprised. So what do we do to combat placebo then? How do we, if we don't know, we go by evidence-based medicine, but what's the best way to try and make sure that we are doing effective treatments and we're not creating placebo?
Yeah, that's a tough one. Well, let's start with not risking nocebo. And that probably involves the same, right? Do no harm, step one. And we probably do that in veterinary medicine the same way we do it in human medicine, which is don't tell dogs or cats or owners scary things. Don't make owners neurotic about what might be wrong with their dog, make sure that you tell them that the state of their pet's tissues does not necessarily mean that they're in trouble or suffering, and that they can probably help the animal not suffer by not being overly worried. So that might be a good starting place. But then we hit the brick wall of the ugly reality is that there are very few evidence-based treatments for pain. And
Yeah.
that means two things. That means both there are no treatments for which there is good positive evidence, strong positive evidence, and also that there are none that seem to work regardless of the evidence. And again, I point to the epidemic of chronic pain. If we had anything that was working miracles, it would be doing it. And the fundamental reason that pain is largely untreatable or very difficult to treat is because it is extremely multifactorial and has deep, deep roots in the system. A simple way of looking at it is that pain is an incredibly important part of being an animal. It is a vital system. You don't last long without the ability to feel pain. And that's a thing we actually know because there's a congenital condition that eliminates pain, and those people do very poorly. It's a really important system, and you can't shut it off, basically, without shutting the animal off. It is just so entangled with our nature that it's super hard to isolate the experience of pain from the rest of the organism.
Yeah.
So, oh, what a great note to end on. Yep, it's impossible.
Yeah. Okay. Well, it just shows, and we always say this, that, you know, it's not embarrassing for owners to come in and be a little bit overwhelmed when we're giving them all this information and not knowing what way to choose, because it isn't easy. And we just try and encourage a multimodal approach. So you're trying to attack it at all angles. And I think you are right. The ultimate dream is to not have arthritis at all and to find some way to prevent it. That's the dream, so that no animal or person has to go through having arthritis, that is prevented before the disease starts. But we're not there yet. So all we can do is manage it. And yeah, I think it's a big, I mean, I feel a little bit like my mind's been blown tonight. So I'm going to have to go away and, you know, really think about how, you know, but I think it's important, isn't it? Because we all are a bit biased. We all probably have some kind of bias that we put on our pets as well. Definitely a positive bias because we want them to be better, even though they're maybe not. I think this has kind of reassured me that objective assessments are the way forward with pain clinics. Like, we need to try and find a way to measure what we're experiencing and what the pet's experiencing and take out our emotion from it. I think that's like hugely, hugely important. What would you say would be your, you know, from a bit of a summary of this, what would be your tips for owners and for vets trying to deal with a chronic pain case in terms of avoiding placebo and working with evidence?
Well, I noticed a great comment here from Louise Wilkes. Anxious owners can create anxious dogs. So thank you for that clarification and kind of correction, because I was sort of leaning away from that and thinking, oh, I'm sure that the dogs are just so positive. Yeah, and I see that now is working on that. That's where we've got some leverage. The more you can do to reassure owners and set them on a less anxious, less neurotic path, the better. And focus on positive inputs. We don't know how much humans can modulate their own pain with positive inputs, and we don't know how much pets can. But let's hope for the best. And so, you know, you could call it the love fix. That pumping as much positivity into your relationship with your pet as possible, and that includes not being excessively worried about them, not being too neurotic and anxious. That's important with humans as well as pets.
Yeah.
Chronic pain is so multifactorial that the treatment is more and more, I believe that the best way that we can treat chronic pain is indirect by addressing systemic vulnerabilities. And that basically means being as healthy as possible. We can't directly affect the experience of pain very easily or very much or for very long, but we can work on our vitality, on our emotional and physical health. And building those foundations is not guaranteed to solve a pain problem, but it might. It might help a lot, because in many, many cases, the problem isn't so much, for instance, the arthritis, but our vulnerability to feeling it. That's certainly an issue with humans. It's probably an issue with pets. So that teaching owners, helping owners to help their animals be as healthy as possible in general may sound like weak sauce as treatment for pain, but it may be the best we can do for any kind of animal, ourselves included.
Yeah, I think, you know, there's a few tools we use with Holly's Army and on Cam as well. We have a It's My Home 2 tool, so it goes through all the things you can do at home to change the management of your pet in the most appropriate way. So things like putting carpet runners down and raising food bowls and things like that. Really small, simple, and generally cheap things to do, but can make a huge difference to the pet. I think weight management is one of the biggest things, and then appropriate exercise, so making sure they're healthy and fit, but not over exercise to the point where they're getting repetitive loads on joints and cause actually predisposing to problems. So yeah, we try and do our best to support. So if anybody's listening and wants any advice, do go onto Holly's Army and ask for it, because there are so many knowledgeable people there who can direct you in the right way. And then if anybody else is interested in learning more from Paul, please check out his website. It's really cool. I've read quite a few things on there. It's painscience.com. It's really, really, really cool website. So you should definitely go and check it out. And yeah, I just want to say a huge thank you to you, Paul, for spending this evening with us. Well, actually, I think it's daytime for you, isn't it, over there? But spending our evening. Yeah, spending your lunchtime and our evening with us. It's lovely to have you here, and we hope you'll join us again for another live at some point in the future.
Thank you very much. It was a lot of fun. Happy to do it again sometime.
Brilliant. All right, take care. Bye, everybody.
Bye, everyone.